Madam Secretary, let's begin with the first part of my opening statement, which was reference to the people of King Cove. And I talked about the medevacs. We want to put that into just nothing more than bad memories. But there's been more than 200 medevacs that King Cove has endured over the past 9 years, 28 of those by the Coast Guard. Risks their crews' lives, costs taxpayer dollars. You've heard it all. You have not yet had an opportunity to speak on the record yet about what your department is doing with regards to the situation in King Cove and why. So if you can this morning say to the committee about why your department withdrew from the land exchange agreement, and more importantly, what can you tell the Alaska Native people of King Cove to assure them that you will finally be the secretary that protects their health and safety?
Thank you very much, Senator, for that question. So the land exchange that we withdrew, as I mentioned to you when we spoke, was essentially flawed. And we felt that by the time it wound its way through, that it would take a very long time, and that perhaps we could work toward a better solution in a quicker time frame. With respect to the people of King Cove, yes, I have like it happened yesterday, my time there with them and with you last year resonates with me, and I've met twice with them virtually and once in person, so I've heard the stories and I understand how difficult it is for the people there to get the services they need. We also visited the clinic. There's no way for them to, it can't be, Anchorage General Hospital on King Cove. The medical services they get there are limited, so we completely understand that too, and the weather. So doctors can't even get into the community at times. So we understand all of those challenges, and I really want to find a solution for the people of King Cove so that they don't have to worry about getting the medical care that they need. What I said in my last meeting virtually with the leadership at King Cove was that, I know that people tell them, move to Anchorage. Why don't you move somewhere where you can get the health care you need? And that's not for us to decide. Our department has an obligation to our nation's Indian tribes. We have a trust and treaty obligation that absolutely includes health care, education, housing, and so forth. So we are committed to ensuring that the people of King Cove can once and for all find a solution to this terrible tragedy in so many ways. And so I just want you to know that two of my high-level staff were just there in King Cove yesterday. As promised, we're following through with our commitment to meet with them, to keep them informed. We want to make sure that that we're informing them every step of this way. And so I just want to let you know that I am committed to a solution there.
And Madam Secretary, I appreciate that you say you're committed to a solution. Are you committed to a land exchange that will allow for the 10-mile one-lane gravel non-commercial use road that will allow the people of King Cove to gain access to transportation to take them to the public health facilities that they need?
Senator, I don't want to, all of these things are pre-decisional, and I don't want to cause any part of this to fail on my part. So I just want to assure you that we're committed to a viable solution for the people of King Cove. And we will keep them informed of that.
You and I recognize that processes like a land exchange cannot be done with a snap of a finger, cannot be done overnight, that they take time. We can all count backwards from the end of a term. We can all look at steps along the way when it comes to a required EIS and how long the process takes. And I would suggest to you that we do not have unlimited time to do this under your watch. And if you are committing to the people of King Cove and you're committing to me that you will find a solution that will address their public safety concerns, we don't have the luxury of time. And so the promise to just keep us informed, in my view, is not satisfactory. If we're going to accomplish this, if we're going to address the wrongs that have literally been perpetuated on these Native people by a government that basically came in and said, this area that you have utilized, that you have used for access, for hunting, for your cabins, we're going to designate as a wilderness, as a refuge area, and no consultation, no input whatsoever, just cut off. You know that's not right. They know that's not right, and we need to rectify this. We've been working on this now for over 30 years. For over 30 years, 200 medevacs. People died. You've talked to, you have heard from those whose lives have been forever changed by the inability to gain access to a simple one-lane gravel, non-commercial use road. It ought not be this hard. I need you to be this warrior. I want us to be looking at how we can legislate, because we know that will be the quicker route. Mr. Chairman, my time has expired. Thank you.
Thank you very much.